Okay, so we're going to start discussing a little bit more on the economic side of One Health now. So we spent the morning discussing One Health specifically, and now we're going to get into sort of the economic thinking, the economic tools that are sometimes used in addressing the problems of One Health. So to start us off with this, I'm going to just review 3 papers. They're all very important in the literature, but not to say that they're the only papers that should be considered if you want to read more into this. But the 3, I think, a mix of good 3 papers to get us thinking about the work that's been done and where economics can help in the One Health space. So the first paper that I want to discuss is actually a book chapter from One Health, the theory and practice. So it's a chapter called One Health Economics. It was originally printed in 2015. There was just a second edition printed, I believe, in 2020. So this is from Jakob Zinstag and his co-authors. So just to start us off, the way that he starts it is just to say that One Health is about the added value of closer cooperation between human and animal health. So you'll notice that there's a little bit of a focus more on 2 of the 3 sectors immediately. Understanding the cost benefit and cost effectiveness of integrating human and animal health interventions is key to promoting this approach. So I think this is kind of an idea that's sort of gaining traction now, is that it's important to be able to make these economic arguments when you want to promote One Health. Also, disease control can affect both animals and humans, and the cost and benefits can cross between the 2. So he's touching on these main ideas through 4 case studies that are illustrating these different aspects of One Health economics. So we'll go through them one by one briefly. So the first is health services for mobile pastoralists in Chad. Second is brucellosis control in Mongolia. Third is rabies control in an African city. And 4 is the cost of bovine tuberculosis in Ethiopia. And each has their own important lessons to be learned. So starting here, so mobile pastoralists in Chad, they live a mobile lifestyle with their livestock, which excludes the humans from these health services and also excludes the livestock. It's quite difficult for them to receive care for themselves or for their livestock. What they've done here is they use this integrated approach with mixed teams of veterinarians and public health personnel, and that to develop and understand the health status of the pastoralists and their livestock. So they have this joint health service where they work with the Chadian public health and veterinary authorities to combine cattle vaccination and childhood vaccination. So a few nice things have come out of this. So by combining these 2 vaccination programs, not only did they save money, I believe around 15%. So not only did they save money by combining their efforts, but they also vaccinated more animals and more children than they would have otherwise. So this is a bit because of the efficiency of the program. It's a bit because of some hesitancy for people to vaccinate their children, and seeing the cattle vaccinated can sometimes make them a little less concerned about vaccinating their children, or vice versa. Brucellosis control in Mongolia gives us another example. So brucellosis is a zoonosis that causes late-stage abortion in animals. This is most common in small ruminants and cattle. Humans can also become infected with direct exposure or consuming unpasteurized milk or milk products. When a human has brucellosis, it's necessarily life-threatening, but it's a major livelihood impact because they now have this recurrent fever and chronic pain throughout their life, and that can have significant livelihood and quality of life impacts on the human. And there's been a reemergence of brucellosis in Mongolia once they've switched to a liberal market rule. So there was a question raised in Mongolia about whether it was cost effective to vaccinate their 25 million cattle, sheep, and goats to prevent human brucellosis. So there was a One Health assessment conducted to see whether or not these mass vaccination of livestock would be beneficial to human health. So when we frame it in that way, the mass vaccination of livestock for human health, we see that the cost of the intervention was higher than the public health benefits, or rather that the benefits, the savings to human public health was lower than the cost of the intervention. But this isn't a very good way of thinking about the problem from a One Health perspective, because it's not just the public health that benefits, right? It's not just human public health that benefits. So there are multiple benefits that come along with controlling brucellosis in the cattle population. So when you combine the savings from the reduced burden of disease in human health, households, and animal production, you see now that this last column, the total societal benefits on the far right, it's nearly triple what the cost of the intervention was. So by having this One Health understanding of the benefits outside of just one of the sectors, you can then begin to understand that it is an intervention that's worthwhile with really significant returns for the cost of the intervention. Yeah, so that's basically what I just said. The next one we'll discuss is rabies control. So this photo is actually Jakob Zinstag holding a dog while it's being vaccinated for rabies. And so rabies is a viral disease that's transmitted mostly through dog bites. And this is something that I think a lot of the participants on this call are quite familiar with because most of the world has rabies. We're one of the very few countries in the world, in Australia, that doesn't have rabies in the population. So rabies is transmitted through wildlife, but also primarily the primary contact or the infection from for humans comes from dog bites. So human cases of rabies are fatal, and they can either be prevented through post-exposure prophylaxis, PEP, or mass dogs vaccination campaigns. So there was a study done in Chad that looked at the cost of an intervention with a mass dog campaign versus the business as usual of just the PEP. So they look at the cumulative cost of PEP alone and the cost of the dog vaccination plus PEP, because even if you have the dog vaccination, you still will have some exposed humans that will receive PEP. So they measured this cost effectiveness through what the health economists in our call will be quite familiar with, the DALYs, the Disability Adjusted Life Year, and tried to see if an advantage to using One Health approach is there. So they conclude that this is a countrywide or regional approach is most promising to reduce the risk of reintroduction of dog rabies, because the wider your area of protection, the better off you'll be. But what are the results exactly? Here, this dotted line that's running up at about a 45-degree is if you're just relying on the PEP alone. So the y-axis is the cumulative net percent cost of rabies. So the straight line going across, or basically straight line, is if they go through the dog vaccination, the mass dog vaccination. And you can see in year one, it's an absolute loser compared to PEP. Because the PEP, it's just over $5,000 US, and that's just to say some people are going to be bitten and we're going to treat them. But then when you continue on in year two, it's like some more people have been bitten, so we need to treat them some more. Whereas the costs associated with the mass dog vaccination is really realized in the first year. So we've spent something like $43,000 to vaccinate the dogs, and now dog bites are going down quite substantially. Because at the baseline of this study, there are about 100 people per year that are bitten by a rabid dog, and on average, 7 of those would die. So then you imagine that, dogs aren't just biting humans, they're also biting other dogs. So by leaving it unchecked, there's growing rabies in the population of dogs and humans. More rabid dogs means more human exposure. So we see in the short term, the net present cost of rabies is higher when we look at the PEP plus the mass vaccination, which is that solid line running horizontally, versus just PEP, which is the dotted line running diagonally. So that's from this initial cost of the program, but we see that there's around year 6, there's a point where there's a crossover. So the important thing learned in this study is the time horizon used in your One Health research. So where if we were to look at this, if we were to look in just, what's the 5-year return on this, we would conclude that no, this is absolutely not worth it. the mass vaccination campaign doesn't justify the costs if we stop at year 5. But if we go to year 6, we see that's our break-even point, and every year we go past that, we see that there's benefit to be realized through this mass vaccination program. Okay, so I believe this is our third. So this is the cost of bovine tuberculosis in Ethiopia. It's caused by a pathogen, Mycobacterium bovis, and it's mainly infects cattle, but it's also transmitted to humans. So this is happening through the consumption of unpasteurized milk and also direct contact. And we can also see that it's transmitted into wildlife reservoirs. So if this is unknown to some people in the call, a reservoir species is a species that can be infected with the disease without having serious health impacts, or not always. It's a species in which this virus or bacteria or what it may be will thrive inside of the species. And if there's a reservoir species, it's a lot more difficult to eradicate a disease because it's out there in the population of some other species that isn't being significantly impacted in a lot of cases. So some examples of reservoir species for bovine tuberculosis are white-tailed deer in Michigan in the United States, badgers in the United Kingdom, or there was a case for lions in the Kruger National Park in South Africa. So this last point about lions raises an interesting issue, because economic losses generally are in livestock. So this is happening through reduced fertility, abortion, weight loss, losses in milk production. But these lions in Kruger National Park also show that it can impact tourism and wildlife. So wildlife impacts can cause a drop in tourism, and also there's the cost of the human infections if you're unwell from tuberculosis. So this is prevalent in peri-urban dairy production in Ethiopia, with some human cases and no confirmed wildlife cases. So the livestock population models were used to simulate the impact and prevalence of dependence of disease in the production parameters, such as milk yield and fertility due to bovine tuberculosis. Yearly productivity from cattle, bovine tuberculosis would be reduced by approximately $29 per year. So this is more than the cost of annual tuberculosis testing per animal. But if we were to extend the cost, so the benefit of testing is greater now, but if we start to include culling of test positive animals, this program is no longer beneficial. And that's if we're only considering the cost benefit inside of animal health. So at the exclusion of these other areas, it doesn't seem like a beneficial program. So other things to keep in mind here is that tuberculosis risk to humans is not accounted for in this model. And because it's peri-urban, there's a lot of exposure between livestock and humans. And as this industry grows, there will likely be an increase in this contact because of the more intensive dairy farming. So a few lessons that Zinstag tries to promote to his readers at the end is that there's no joint metric or diseased humans and animals, because humans have a unique moral value while animals are valued differently based on culture and economic context. Right, so the way that a cow is perceived changes quite significantly depending on where you are in the world. The value of a cow changes a lot. The value of a chicken changes a lot. A lot of these values that we place on things are quite ingrained in culture. He points out that monetary values are appropriate for animals, while non-monetary values are like dailies are more appropriate for humans. So this is to say that, in a lot of circumstances, we can put a dollar value on livestock because there's a market for livestock, whereas there's not a market for humans, so it's difficult to put a market price on humans. But this is something that health economists can work out with dailies. It's just probably not the most comfortable thing to do. So the composite outcomes of the interventions are expressed as cost per daily averted for the human component and financial cost benefit for the animal component. So this is what he says is that, instead of putting a dollar value on the daily, you can just say this much per disability adjusted life year. And similar to the first point we made, cultural differences should be taken into account in these analyses. And the application of One Health economics needs to extend in both directions. So there's been thorough investigations on the impact of human diseases on animals, human diseases on animals is not very commonly researched, although there is some. So further exploration of the impacts of human animal diseases on human industries will receive increased attention due to the potential for significant economic burden to society. So the One Health concept extends beyond zoonoses, as illness in one sector can spill over to another in indirect ways. The current focus on research of One Health concept is primarily focused on proving the efficiency of the concept through the animal to human side of the relationship. So this is critiquing again that environment's being left out in a lot of the work. Shows demonstrable economic evidence of the advantages to bidirectional economic analysis across human and animal health related sectors. And the human to animal interface will require further attention for the benefit of both animal and human health, respectively. Once the One Health concept is ready to evolve into a closer iteration of the holistic design as initially envisioned. So he's, one of the critiques that he makes is that there's not enough consideration for the impacts on animal health as humans delivering the disease to animals. So that's one paper. We're a bit pressed for time, and I know that there's a lunch standing at the end of my talk, so I'm going to be working very hard to stay on schedule. So another paper is from Delia Grace. She's, at least at the time of writing this, she worked for the International Livestock Research Institute in Kenya. I'm not sure where she is now, if she's still there. But she has another interesting article. So it discusses the process of building a compelling business case for One Health in the context of a theory of change. So she presents this Big Five framework for categorizing the One Health problems and related interventions. She provides estimates from the literature on the costs of the One Health problem, as well as likely costs and benefits of One Health interventions, drawing on a small number of key articles and reports. So these 5 areas that she's identified as potential areas of economic gains to build a business case. The first is sharing health resources between the medical and veterinary sectors. Second is controlling zoonoses in animal reservoirs. Third is the early detection and response to emerging diseases. Fourth is the prevention of pandemics. And finally, the last one is generating insights and adding value to health research and development. So her first one is a bit like we discussed in the first paper about the pastoralists in Chad. So sharing health resources across human and veterinary sectors, especially in laboratory facilities, is an easy win due to common pathogens and chemical hazards. She also points out that the curriculum is quite similar in the early stages for lab technicians in both veterinary medicine and human medicine. So there are efficiency gains by making shared education resources feasible. And then the surveillance system, disease control in remote communities, and joint vaccination programs are other potential areas for collaboration. So this is what we discussed with the pastoralists in Chad from the Jakob Zinstad chapter. So estimating the benefits of collaboration, she says, is challenging, but the evidence suggests that joint operations can save around 10% of the combined medical and veterinary budget devoted to the shared services. So laboratories, education, and management of zoonoses are services that can be shared and constitutes 5% of the human health budget and 40% of the veterinary health budget. So you can see where the impact would be a bit more in veterinary health. So her estimate here is that total savings of joined up services could be 2.65 billion US dollars per year, implying gross savings of around $4 billion per year. So controlling zoonoses in animal reservoirs is the next one. So she points out that there's been success in controlling zoonoses in the past in animal reservoirs. So diseases like brucellosis, rabies, salmonella, and others have been controlled successfully in many countries. So the other reviewed literature that she has identified in this study show a positive benefit to cost, with human health benefits usually being greater than animal health. So that's to say whenever you control in an animal reservoir, it's always worth it. The returns are always greater than the cost of the programs. So she points out zoonoses are responsible for a 25% livestock mortality rate in low-income countries, with estimated losses of 68 million tropical livestock units and costs of about 25 billion US dollars per year. So a livestock unit, if you're not familiar, is a way to compare different types of livestock as one. So a livestock unit of one would be something like a camel. I think cattle is 0.9. Pigs are something like 0.4. So basically, if you think about the size of the animal, the smaller it gets, the smaller it is as a tropical or as a total livestock unit. All right, so human health costs of zoonoses are at least equal to livestock sector losses, with an estimated loss of about 50 billion in 2013. So if you guys are reading these numbers and thinking, wow, these look pretty low, it's you're right, because it's pre-COVID. So we can imagine that all these estimates are substantially less than what the reality has become after COVID. And total annual cost of zoonoses could be around 85 billion US dollars, and a control program could avert these costs with an expenditure of just 21 billion over 5 to 10 years. So these are some of the studies that she had looked at for different diseases that were controlled in animal reservoirs. And you can see, benefit cost ratios 3.2 for brucellosis. If we look, even in some of these, you can see here in these costs considered, some of them aren't truly One Health studies, because you see that it's only livestock, that it's in livestock only, or it's not always including costs outside of a single sector. But even here, this example of brucellosis in the Czech Republic, it was a 7.1 benefit to cost ratio, only considering the costs and benefits within livestock, excluding completely the benefits to human health. The next one is early detection and response in emerging diseases. So rapid response is crucial to reducing the cost of the disease. And she goes about this by looking at what basically a good case and a bad case in different outbreaks. And she finds that there's about a 95% reduction in the costs based on a good response versus a bad response. So potential losses averted are about 95%. So here the World Bank estimates that outbreaks cost an average of about 6.7 billion US dollars. As we know, that number is a lot bigger now. And investing just 3.4 billion in animal health systems per year could support effective and efficient functioning of these systems and avert losses. So this 95% reduction in cost amounts to about $6 billion saved per year. Next is prevention of pandemics. So ongoing losses from disease outbreaks have become a new normal. There's significant concern over the possibility of a civilization-altering pandemic or plague, which have occurred throughout history. So we know very well that to be true. The World Bank conducted a study of possible impacts and cost averting high impact, low probability pandemics, with a key message being that a severe pandemic costing 3 trillion could occur once in 100 years. And that timeline seems to have kept. So we went from 1918 pandemic to COVID-19, and $3 trillion for the COVID-19 cost of the COVID-19 pandemic is on the lower end of what I've read in the literature. If investments are made in One Health systems and such a pandemic is prevented, the global expected benefits are approximately 30 billion US dollars per year, with the estimated annual investment of 3.4 billion to produce that expected benefit of 30 billion for the international community. So investing 3.4 billion US dollars in strengthening veterinary services can deliver two streams of benefit. The first being averting the major pandemics, and the second being improving the timelines of response to outbreaks. So between the two, diverting the pandemic is an annual value of about 30 billion US dollars, and the timely response to an outbreak is valued at about US $6 billion per year. So the last point that she makes, this is a little less concrete than the others, but this is that One Health and EcoHealth lead to a better research and disease control programs, as well as ecosystems better able to provide health as a regulatory service. The cost and benefits of adopting One Health and EcoHealth as an approach. So yeah, they're difficult. It's difficult to quantify this. So she says it's an important area of research, but monetary estimates cannot be provided. Then I think she does provide some. So this is just kind of in summary, all the things we discussed. So 25 billion annual investment over 10 years would generate net annual benefits worth about 125 billion US dollars. And additional benefits include saved dailies and conserved ecosystem health regulation. So this is already saying, if you're investing in these One Health areas with different levels of confidence, you can see on the right-hand side of the table, controlling zoonoses and I think it'd be maybe less confident, or no, more confident, controlling zoonoses. So you can see that there's, pretty significant impacts for not so insignificant investments. So about a 5-to-1 return on investment. So developing a comprehensive and credible ex-ante assessment of the business case for One Health and EcoHealth requires investment itself. The business case needs to consider the options for controlling disease and their likely efficiency, effectiveness, and acceptability. So, and this is her then promoting the idea of a multidisciplinary team with skills in epidemiology, economics, and an understanding of developing country livestock sectors, which could build the business case. This is a problem that we run into a lot with our work, is that emerging and neglected zoonoses have typically been managed sectorally. So they're siloed, there's money that goes to a certain ministry, and once it sits in that ministry, there's not always good communication across health and environment and agriculture. So the evidence shows the benefits of One Health management for these diseases. There's a need to make a bigger case for massive investment in One Health to transform the management of neglected and emerging zoonoses. This investment would save millions of people and hundreds of millions of animals, whose production supports and nourishes billions of impoverished people annually. So that prediction unfortunately became quite true in the last couple of years. And we only have a couple of minutes, so I'm mostly going to skip over this one, but this will drive home one of the points from Delia Grace's study. So I'll just kind of take you to the most interesting figure. Not this one, but this is just to say, COVID's here. This is, we thought that SARS was expensive, and now COVID showed up and showed us that it's not that expensive. This is the one that I wanted to discuss, is the benefits of acting quickly. So this is something that Delia Grace had mentioned in her paper. But we can see here when there's the initial exposure to animals, it's quite difficult to act in this first bit of time because there's no clinical signs in the animals. But once that happens, if we can move quickly before there's a massive spread with the clinical signs in animals to mitigate the pandemic, then we're in a good spot. Unfortunately, the longer you wait, the more exposure there is now to humans, and then clinical signs in humans. And once you see this, once the clinical signs in humans happens, you see a massive increase in the cost of controlling an outbreak. So this is why disease surveillance inside of the animal population is so important, and but it's absolutely a global public good. And the economists on the call know that public goods are, it's difficult to finance a public good.